Thanks for tuning in to Healthy Planet One, where we discuss healthy living from experts in each of their fields. This is your host, Patricia Starr.
And your co-host, Kimberly Knock. Hi, everyone. Today's guest on Healthy Planet One is Dr. Amy Novotny. Now, when I spoke with her, I was so excited to have her on the show. She's an extraordinaire. She is a healer. She's an author, a speaker. She has her own Sunday show advocating health and topics. She's an ultra marathoner and a photographer, quite talented and diverse here. Dr. Amy, welcome to our show.
Thank you so much for having me. I really appreciate you bringing me on.
Yeah, so we're going to be talking about how to calm down your nervous system.
Yes.
That's going to take care of a lot of things people don't like chronic pain, stress, anxiety, having to use medication, surgeries, and even more. So tell us, Amy, a little bit about, you founded the PABR Institute, and you've got a background in orthopedic, sports, geriatric. You've co-authored an best-selling book on Amazon, Don't Quit, Stories of Persistence. So tell us a little bit about this PABR method that you've coined and created.
Sure, absolutely. So PABR or PABR, it stands for Pain Awareness Breathing Relief. And it developed basically through my background. I started in a doctorate looking at the body, physical therapy, that type of thing, but I started studying the nervous system and how to calm it down. And I was running marathons at the time, trying to qualify for the Boston Marathon. And I had the typical aches and pains, you keep under control when you're a long distance runner. And all of a sudden, I started working on breathing and looking at asymmetries in the body. I was taking some coursework, but I paired that with studying the nervous system as I was on a treadmill running. And I realized that when I played with my breathing and my body position, I could hugely impact my nervous system and calm me down in the middle of a fast run. And all of a sudden, tightness would go away. Pain would go away. I was like, whoa, this is weird. And so it's a matter then from that, I implemented it, started running marathons faster, qualified for Boston easily without any other changes in training. Wow. And then it's like,
so
okay.
Does this pair, you just piqued my interest. Is this similar to, I never made it through the breathwork class when I was pregnant, but does it have some parallel to that?
Different from that. I've actually helped pregnant women go through labor without any medication using this method, and they'd had previous kids or they had kids since then, and they said this helped them immensely. So it's different from that. And the reason why is I studied so much with anatomy and physiology. I base the way that I teach this breathing on your anatomy and physiology and how to maximize it so that you're changing your anatomy but calming your nervous system down so you can breathe easier and get more air into your lungs all over.
Wow. So that's amazing. So what kind of cases do you see so people can grasp their head around this amazing technique?
Yeah, so it initially started with just various types of pain. Regular everyday pain, then it turned into chronic pain. Then I started helping athletes who wanted to do 50-mile runs pain-free. And when I started doing that, people told me other benefits. They dropped their medications. They could sleep better. They had all of a sudden people were getting out of surgeries. People who were bone on bone and scheduled for a joint replacement. I said, let's try this on you. Let's calm your nervous system down, allow your body to go back into a neutral position, and create space for your joints, see if we can get you out of the surgeries. And sure enough, it did. And it even holds, too. The one lady I worked on was 4 years ago, and she was doing injections. She was on anti-inflammatories. She was trying to travel around the world. She's a psychologist, well-known in the Phoenix area, and she was doing all these things to just get her to be able to travel around the world to photograph wildlife. And now, since we worked together 4 years ago, within 2 weeks, she canceled the surgery, hasn't taken one more anti-inflammatory, and has not had another injection since.
That is
huge.
That's huge. Yeah. So what does that say about pain? Like the whole concept of pain.
Yep. Yep. Actually, my idea of pain has really shifted. I tell people when you get pain, pause. It is your body's signal to your brain that something is out of position. And I say, before you do anything, take note. There is something that has shifted in your body, and it's actually related to stress. Because when you get stressed and kicked into that fight or flight mode, your muscles tighten. We think about just cortisol levels going up, but it's actually your muscles also respond by increasing their contraction all over your body. And if your body position is slightly out of neutral and those muscles tighten up on it, you're going to get tissues that pinch up. And typically what happens, you wake up one day, you have pain, you're like, where did that come from? And you can usually find several stress triggers that happened right about that time. And your body then goes into this protective mode. And the unfortunate thing is we often don't know how to get out of it. And that's where it turns into a chronic cycle of pain.
Yeah, so a lot of us think about pain, and I know Patricia deals with pain a lot, through your work too, but we often think of pain, or I do, like sometimes as trapped energy, or does that relate to your definition of pain as well?
Absolutely. And it's funny that you mentioned that, because in the past 2 years, I've started to work with psychologists and psychiatrists with them themselves to treat them because they're taking in everyone else's pain, but then also to work with their clients because there's a lot of energy trapped in mental and emotional anguish that goes into the physical body. And so teaching them how to free all that up from their physical body, it is so amazing to see a transformation in someone, their freedom in their movements, their freedom in their whole spirit, their vibrations.
So I'm
Patricia,
fascinated. Hi, this is Patricia, because I'm all about structural alignment, and I'm all about breathing. So I'm loving listening to your comments. Tell me a little bit more about, you did coursework from the Postural Restoration Institute. Mm-hmm. Tell me a little bit about that approach, and then how you've encompassed that in your work.
Sure. So that's where I first got exposed to the asymmetries of the diaphragm and the asymmetries in the body that impact our compensations and our movement patterns. And from there, great organization, love them to death. And so I took that information and I said, okay, how can I truly integrate this, and what is missing that I didn't get? And so that's when I started experimenting and studying about the nervous system more, and how our brain controls our nervous system and the two interact, and how the nervous system, your fight or flight nervous system, really impacts your muscle tone, which impacts your body, and how your body position itself impacts your nervous system.
Yeah.
And if you think about it right now, anyone listening, if you sit in your perfect posture, if you do what we're all taught since we were 3 years old, sit up straight, suck up your gut, pull your shoulders back, you will feel instantly, most people, tension increase throughout your body. We don't realize by doing that, we kick ourselves into fight or flight mode. Yeah. And the problem is we often do it excessively, and that's where we get trapped.
Mm-hmm. I love it, because the diaphragm is right in the middle, if you will. It's your core, and people don't realize that they're in a torqued pattern, and they think that's normal, right? Because I see that quite a lot in the work that I do, and working with in my work we start with the cranium, so we actually are actually aligning the body in a way that the nervous system can be more open and free. And the diaphragm is all about breathing. So that just segues beautifully into what you were talking about earlier, and the importance of learning how to breathe properly. Can you say more about that?
Yeah, sure. So I actually start with your rib cage position when I talk about breathing. Mm-hmm. And the reason why is your diaphragm is dependent on your rib cage position. Your nervous system is dependent on your rib cage position. We don't always realize that. So if we do that perfect posture, you actually tilt your front of your rib cage up, and it hinges off of your low back. And so one right there is going to kick in your back muscles crush on your sympathetic nervous system, flare you up. But also, when you lift up the rib cage position, you lose your contraction of your side abs to pull your ribs down into neutral. And when you lose those side abs because you're lifting up in front, the side abs can no longer be as supportive for your diaphragm as the diaphragm needs.
Mm-hmm.
So it's harder for the diaphragm to contract down to really use your diaphragm to get air in.
Mm-hmm.
And so because of that, we lift up our ribs or lift up our shoulders or hinge off of our back or lift up our head just to get air in. And that's where all this accessory muscle play comes in.
Uh-huh.
So I tell people step one is to get your rib cage back down, which means you have to let your belly button go.
I love that.
Stop sucking it in.
Yep. That's my motto. Let your belly go. I tell people that all the time. Let it go. Yeah.
And people don't really know. They're not even conscious of their breathing. So that's a whole nother instruction for them, isn't it?
It really is. And so because we're not often conscious of it and we often hold our breath or we breathe through our mouths, I tell people, okay, let's just get you started. Let's practice 5 minutes when you wake up, 5 minutes before lunch, 5 minutes before dinner, and 5 minutes when you go to bed. Because those are nicely defined areas. Sometimes people miss lunch, and so I say, before a snack or something like that. But if we can start to shift the way they breathe and have them spend just a couple minutes concentrating on it, their nervous system wants to change. Their body wants to change into an easier existence. So we just need to get going on that and give a little bit of help throughout the day, and you'll start to feel your whole body shift.
Mm-hmm. Yeah.
Yeah. That's great.
Absolutely.
That's great.
Now, I'm very curious. You talked about having a client that had a bone-on-bone in a joint, particularly, right?
Yes.
And through your method, you were able to shift that. Can you say a little bit more about that?
Sure. So this person, she psychiatrist or psychologist, and she bone on bone in the knee. Pain for years and years and years. Did the 3 injections per year, the Synvisc, all of that, anti-inflammatories, I think daily, and couldn't walk on unstable surfaces to travel. She wanted to go to Italy. She couldn't walk on cobblestones, and we started working on it. And so the thing with her, she held a lot of stress in her body. If you imagine a psychologist working with people all day long, hearing their stories and working so hard to help them to get out of their trauma, she took on a lot of that stress. Mm-hmm. And her body position reflected it as well. Mm-hmm. So all we did, I didn't even touch her knee. All we did was I worked on her trunk, shifted the way that she breathed, shifted the way she used her back, so she stopped overusing her back, her pelvis freed up, her knee pain went away. And I do this virtually now too. I had a gentleman over the summer who contacted me, scheduled for a hip replacement, had tried everything, tried even stem cell, which helped quite a bit, but couldn't even bend over to tie a shoe. Mm-hmm. He had stopped rollerblading, he stopped playing hockey, stopped hiking, stopped cycling, and he was in his, 60s or something. And we went through a virtual progression. And through this, I showed him the steps. I taught him what to do. And what it truly is I got to get him to feel a sense of a shift in his body, help him feel muscles release and other ones activate while he's breathing. And you want to do it while you're breathing so it changes your nervous system. And so he was able to get himself out of pain, his return to all of his activities, not doing surgery. And it's truly a matter of calming the nervous system down so you sense your body differently. You learn how to relax muscles that you know were tight but didn't know how to feel enough to relax, and then activate other muscles to pull you back into neutral, to free up your body, to free up the pressure in your chest, all of that.
So I have a question because I deal with food, and I was just sorry, I was just thinking about that pressure and getting to know the body. Caffeine plays a big role in people like, being stimulated all day. Mm-hmm. Do they function better to listen and to work if they're like